Over the pandemic, heart disease and diabetes deaths increased significantly. Recent data from the CDC shows these death rates saw the biggest jumps in at least 2 decades. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, we're talking about this increase in St. Luke's unique treatment model for heart disease and type 2 diabetes that's now being used across the country. With me today is Melissa Magwire, Program Director of the Cardiometabolic Center Alliance founded by St. Luke's. Thank you so much for joining us.
Thank you.
Well, Missouri was one of 4 states with the highest increases in heart disease deaths in the country. Are these local and national increases concerning?
Extremely, and disheartening as well, because we've made so many inroads into the treatment and prevention of heart disease. And then you double that with the risk of the pandemic and COVID-related cardiovascular diseases, and it's very concerning across the board, yes.
And what can be contributing to this sharp rise?
So I think a lot of what we're looking at is sort of some backlash from the pandemic, unfortunately, because as we mentioned, we were seeing a decrease in cardiovascular disease and complications from diabetes resulting in cardiovascular disease over the last couple of decades. We still weren't where we needed to be, but the inroads had been made. And the sharp contrast in data from 2019 to 2020 in both diseases related to cardiovascular disease deaths and diabetes deaths really kind of made us take a step back and pause and say that perhaps during the course of the pandemic, maybe folks weren't paying as much attention to their health. The number one thing to do for cardiovascular disease in the setting of type 2 diabetes is prevention and preventative health and preventative self-care measures. And we know that we all put some of that on hold over the last year.
So explain the interplay between heart disease and diabetes and how that led to the creation of the Cardiometabolic Center of Excellence here at St. Luke's.
So those living with type 2 diabetes are about 32% more likely to have some form of cardiovascular disease, or 2 to 4 times more likely to have an adverse event resulting from cardiovascular disease. So my background early on was a cardiovascular nurse, and then I did 27 years of practice in adult endocrinology. Continued to see inroads in the treatment of type 2 diabetes, but was still seeing those impacts on cardiovascular disease. Whereas the physicians at the Cardiometabolic Center of Excellence here at St. Luke's were preventative cardiologists, they were seeing those issues as well. So it made sense with the advent of new treatments that are coming out now that look at not only treating type 2 diabetes, but also reducing cardiovascular death, side effects, hospitalizations for heart failure, that we look at this disease as actually one disease and not 2 separate diseases, because they are so linked.
And what results have you seen with this unique approach?
So it was amazing. Early on, we actually saw a decrease in all of those risk factors that we were targeting in this global approach. We saw a decrease in cholesterol levels, a decrease in weight, a decrease in overall glycemic control, or an improvement in glycemic control, decreases in blood pressure. All of those things which we know are cardiovascular risk factors, especially given the setting of type 2 diabetes. And that occurred fairly early on in this very targeted, patient-centric team approach that we were using here locally at the Haverty Center of Excellence at St. Luke's.
And so how is this model now being used at sites across the country with the Cardiometabolic Center Alliance?
So as we started to see these results locally, we started to get inquiries from healthcare practitioners across the country saying, okay, how are you doing this? We know we ought to be able to, but we just haven't seen these results locally. So what we did was take our model of care here that we developed at St. Luke's and package that per se in a way that it could be utilized in other health systems across the country for providers to start their own cardiometabolic centers of excellence, or take what they have and sort of merge into this treatment approach of guideline-directed medical therapy in the setting of both type 2 diabetes and cardiovascular risk reduction, looking at it as a one entity, one disease state, and then utilizing this patient-centric care coordinated model that we use here.
Great. Well, what's your takeaway message today for those who are dealing with heart disease and diabetes?
It's time to get back at it. Unfortunately, the pandemic really put a lot of self-care on hold. And unfortunately also as well, in the setting of type 2 diabetes, you may not have the typical symptoms of heart disease that those living without diabetes have. And it can be happening as early as 15 years prior to your diagnosis of diabetes. You can have some of these risk factors really making inroads, unfortunately. So get back at it, the healthy eating, the diet, the weight loss, and check back in with your practitioner. There's no time like the present to really look at moving forward with this preventative care.
Well, thank you again, Melissa, for joining us.
Thank you.
If you'd like to find out more about St. Luke's Michael and Marlys Haverty Cardiometabolic Center of Excellence and the work they're doing with the Alliance, visit stlukeskc.org/cardiometabolic. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.